Hi everyone, this is Dr. Devin Barley with Greenwich Bay Chiropractic, and in this video series we're talking a lot about whiplash injury. Now whiplash is known as an acceleration-deceleration force, basically a lot of extra motion when you're not prepared for it. And 90% of cases when you think about someone you know who has had whiplash probably include a car accident. But did you know that whiplash can happen any other time, whether it's a slip or a fall, whether it's a sports injury, or whether it's something like being on a roller coaster or going to a theme park and turning your head the wrong way. These can all cause whiplash symptoms as well. So what we know is that thinking about whiplash, there are multiple different causes and there's a multitude of different symptoms, whether it's neck pain, mid-back pain, low back pain, headaches, nausea, dizziness, numbness and tingling, radiculopathy in your arms or in your legs. So there are so many different things that can arise as a result of the fact that humans are not meant, or they're not built to be put in a position where you're getting rapidly accelerated and then decelerated. So what we want to make sure that we do here in the office is diagnose and treat the problem appropriately and effectively while keeping it gentle so that we can mitigate some of the external factors in terms of symptoms and pain. We do that in a couple of ways. We'll do a careful consultation, talk about how the elements of the accident actually happened. We'll talk about the speed, we'll talk about you being restrained or not, and then we'll do orthopedic neurological testing, and that will include some whiplash tests, including something called distraction maneuver, where we'll actually pull up on the head, and if we see an increase in pain, usually that feels good for people who don't have whiplash. That means that there's some sort of muscular ligamentous injury going on. What we'll do following is we'll take some x-rays, some very specific x-rays, because whiplash accidents, especially involving a car accident, can include things like dislocations or fractures, and we want to make sure that everything is good to go before we take care of you. Now, that being said, you heard me say dislocations and fractures. That's why it's so important to get checked out, especially once you've had whiplash and it's been in a car, because there are other mitigating factors that are involved to make sure that you're getting better and make sure that you're getting the care, the appropriate care that you need. So this is what we'll do here in the office to be able to correctly diagnose the problem. And now we want to talk about treatment. Now, with treatment, we'll do a couple of things. Of course, we'll do some chiropractic treatments. We'll do some therapeutic exercise because we know that if ligaments and muscles are stressed out, we need to get them working the way that they should. And we also want to introduce range of motion to help pump out things like swelling, inflammation, to help get you better more effectively. We'll also utilize tools like intersegmental traction or decompression in the case of, let's say, a disc injury during a whiplash accident. But all of these things are done gently, specifically, and effectively so that we can create a treatment protocol that gets you the result that you want sooner and doesn't leave any lingering symptoms after the fact. So if you've been in a whiplash type injury accident, it's very, very important to get seen early and get treated early so that you can get back to doing all the things that you want to do. Thank you so much for listening. I'm Dr. Devin Barley. We'll see you on the next video.